Well, certainly. Good afternoon, and thank you for your participation in today's webinar. Following the successful initial launch of QI Wrap in April, we're very pleased to reconnect with this group to touch base. Oh, pardon me? We're very pleased to reconnect with this group to touch base and also to introduce you to the 5 remaining reports. Next slide, please. Of note, the webinar is being recorded for future reference. It will be accessible on the Health Quality Ontario website under the Health Links section. The slide deck will be available in French and English once it has been translated. To ensure good sound quality, all participants have automatically been placed on mute. However, we do encourage you to take advantage of this time by asking questions and seeking clarification as needed. To ask a question, please open your control panel by clicking the orange arrow to the right of your screen. From there, you can post your questions into the chat box feature. We'll seek to answer questions regarding the use of the additional QI reports during the live demonstration. You may also find responses to the questions in the chat box. If we're not able to answer your question at this time, we'll collect your question and provide you with a response via email. Next slide, please. We'll hear a few different voices on the line today from Health Quality Ontario. Today, our panel includes myself, Jennifer Raitt, and I'm a Quality Improvement Specialist. We have Sandy Seaman, who's the Manager of Quality Improvement and Spread. We have James Meyer, who's the Project Coordinator. And we have Kamal Babra, Sue Jones, and Julie Nichols, who are also QI specialists here at Health Quality Ontario. Next slide, please. As mentioned, the focus of today's webinar will be on reconnecting with this group to address some of your frequently asked questions and to give you a tour of the additional reports being released within the QI Wrap platform. At this time, I'm happy to welcome Sandy Seaman, Manager of QI and Spread. Hello, Sandy.
Thanks, Jennifer. Welcome to today's Quality Improvement Wrap webinar. I'll start with a message about how we will be communicating with the LHINs and the Health Links about webinars, best practices, etc. Given the LHINs' accountability for Health Links and following several conversations with Health Link leaders across the province, Health Quality Ontario is committed to communicating directly with the LHINs, with the understanding that the LHINs will manage the communication with the Health Links. In other words, Health Quality Ontario will not communicate directly with the LHINs, but will instead direct all communications to the LHINs. Sorry, I think I said that incorrectly. We will not communicate directly with the Health Links, but will instead directly communicate with the LHINs. Now back to the topic of today's webinar. We were amazed with how well you were able to use QI Wrap to report your fourth quarter measures for coordinated care plans and access to primary care practitioners. We trust that entering your data for the first quarter of this year will go just as smoothly. Now that we have a firm foundation for entering data into QI Wrap, we want to support you with a fuller menu of options for analysis of the data. Today we will profile 5 new reports that are available to you. In addition, we will introduce you to standard practices to enter your data and ensure data quality and to analyze your results. Going forward, your Quality Improvement Specialist will support provincial level analysis and assist you to better understand the successes and opportunities for improvement at the regional level. Back to you, Jennifer.
Thank you, Sandy. Next slide, please. Following the launch of QI Wrap, we were able to collect some of your additional questions. Regarding question 1, which is regarding the login process, most login issues can be resolved by ensuring the correct case is used when typing in your credentials, and also by ensuring that the user logs out and closes the browser before attempting to re-enter QI. We have also received questions regarding which primary care indicators should be selected. When you go to enter the primary care data, you'll notice that there are 3 places to choose from. Please select one section only, and that will be the same indicator description that you reported on prior to the introduction of QI Wrap. If you're not sure which indicator to select, please feel free to contact the QI specialist working in your region and they'll help you through that. To request access to QI Wrap for new users, please have the HealthLink lead send a request to hlhealth@hqontario.ca. And you can also use that email address to request password reset. And again, we wish to support your smooth transition to QI Wrap, so please continue to submit your questions to hlhealth@hqontario.ca or connect with one of the QI specialists in your area. Next slide, please. Thank you for submitting your HealthLink indicator data back in April and May. To create a more fulsome set of data, HQO has also added historical data for your HealthLink for the CCP and primary care indicators. And this will allow you to analyze your complete data set for trends, etc. As you log in to submit your Q1 data, we'll ask that you check the historical data that was entered on your behalf. If the data is incorrect, please edit the data and also send an email to hlhealth@hqontario indicating that you've made the change and what the discrepancy was. Please ensure that your data is verified and submitted by July 31st along with your Q1 data. Also, you may wish to take advantage of adding annotations while you're in there. These can be completed in the data entry section of QI Wrap. Annotations are remarks that allow you to provide additional explanation or details about your data, and they display only on the HealthLink report. However, this information can be very helpful when it comes to data analysis and planning for spread. For example, if you introduced a change idea and saw an increase in the amount of CCPs you were able to report, it may be helpful to know what happened at that point, so we can explore that further and potentially share that change idea with the other HealthLinks. Next slide, please. At this time, we'd like to pause and poll the audience and ask you, since the launch of QI Wrap in April, how have you used the QI Wrap platform? We're going to open the poll for 30 seconds while you input your answers by clicking on all of the answers that apply to you. And Julie is going to provide us with the poll results once the poll is closed and the results have been tabulated. Julie? Please go ahead and select your selections.
I see we have an active group this afternoon. We have about 40% of our participants have already voted. That's great.
Wonderful.
We'll give it another 10 seconds or so because I see people are still really actively responding on how they're using the report. Okay, I'm going to close the poll so we can see our results. And here we are. So we can see that 79% of people on our webinar did respond, and the majority, so 58%, have not used the reports from QI Wrap yet. So hopefully our session today will give us some tips and tricks on how to use some of these reports. But the good news is some people have, and some individuals have used the reports. So 26% have used it to communicate with other HealthLinks or the LHINs. They've used it to communicate internally. They've used it, so 13% have used it for internal decision making, and 3% have used it for communication with general audience. So those that are online, I think we have an opportunity to learn a little bit more about all these new reports that we can use.
Wonderful, thanks, Julie. If we could move to the next slide, please.
The webinar has been closed. Oh, sorry, the poll. There we go.
We can move to the next slide, please. Thank you. Perfect. Thanks. During the initial webinar series, you were introduced to the logon process, the data entry function, and how to create the first 3 reports. Today, we're going to introduce you to the remaining reports. So specifically, Kamal and James will take you for a tour of the HealthLink, LIN, and provincial dashboard reports, as well as the provincial snapshot and data entry status reports, both how to create them and how they can be used. Please feel free to print this slide as a reference that outlines the full menu of reports now available to you. Next slide, please. I'm now going to pass you over to Kamal and James, who will take you for the tour today.
Thanks, Jennifer. So for this demonstration, James and I will show you some key functions of 5 new reports in QI-RAP. During the demonstration, James and I will go back and forth using a question and answer type format. And if you have a question during the demonstration, please chat your question into the chat box and Julie will monitor the questions as they come in. If we don't answer your question during the demonstration, we will summarize the questions at the end. So I'm going to hand it over to James to help get us started.
Thanks, Kamal. So just to get started, I'm just going to show everyone how to log into QI-RAP. So you first visit our main website, hqontario.ca. At the top, you'll see several tabs. You click on the Login. This will take you to where you would log in to access QI-RAP. You would enter your username, which was provided to you by Health Quality Ontario, along with your password. And then after that, you would just press Login. You will see several other initiatives that also use our platform. Ours is the HealthLinks one. If you do click on one of the other ones, not to worry. You can close the tab that pops up and then click on the correct one, the HealthLinks one. After clicking on it, this is what you'll first see if you are a data entry user. Over on the far left, you'll see the Measures section. Underneath, you'll see 3 tabs. Just to refresh everyone what these tabs are for, the Data Entry tab is where you would go if you have data entry access, and you would go there to enter your quarterly data. Just underneath, the View Report tab is where you would go to view the aggregate data at different system levels. And just underneath that, the Custom Measures, which is currently not available just yet, but will be available in the future, but only for people with data entry access.
Thanks, James. So just to review, in the last webinar, we went over the HealthLink report, the LIN report, and the provincial report. So how would we go about viewing the 5 new reports?
A good question. So you would first click under the View Report under the Measures section. This is what you'll see. The drop-down box that says Select a Report, you would click on that, and all the reports now that are available will appear. The 5 new reports, the first being the Data Entry Status, the Provincial Snapshot, and the 3 dashboards, the HealthLink, the LIN dashboard, and the Provincial dashboard. Okay. So just to start, let's just select one of the reports. We'll begin with the Provincial Snapshot. I would select that from the drop-down box, and then you would click on View to generate the report. Just to let you know, Kamal, you may want to use this report if your objective was to see the cumulative totals for all measures or a specific measure across the province for a specific time period. You may also want to use this report if you wanted to convey high-level information to stakeholders in the presentation. For example, you may want to know the number of TCPs created for a certain time period. This report will get you those answers. So to begin, I would have to start filling out the parameters. All required parameters are marked with an asterisk. The flow of entering the parameters are the same for all reports, which you begin in the top left and then make your way to the right, and you go from top to bottom. The first one is the start years. You'd select how many start years you want. All HealthLinks within these start years that contributed data would get captured in the snapshot. After that, the topics would appear. We have 2 topics, coordinated care plans and primary care. You can select one or all using the select all. The measures associated with the topic will automatically get pre-selected along with the fields. You can choose to only display one measure or customize the topics, meaning say you would only want to see the actual or you only wanted to see the target. I don't want to customize any of my selections, and also I don't want to customize the start and end date. I want to see the entire range of what's been captured for all of these start years. So I'm going to view a report. At the top, it will tell me 64 operational health links have contributed to either the CCP or the PCP. The outcomes always appear in alphabetical order, so the first being your coordinated care plans, followed by the primary care provider fields. So I can see my target of the aggregate amount of all the 64 health links totaled 8,667, with my actual total of number of CCPs created for the entire data range of 7,407. The primary care one is a little bit more extensive. It does show all the fields associated with this topic. So basically, at the very bottom also is the actual and target formulas. So just to expand on this, if I look at the record target, the Access 1 target, and the other one, if I add up all these, that would be the target formula, and it would be 18,130 of the targets, and then there's been 19,640 attached. If this page went over to another one, I could use the pagination bar at the top to scroll through. The Save button, I can click on it, and it will show me all the other formats where I can export the data in, so Word, TIFF, or an Excel. Or I can also choose to print right from here by just clicking on the print button. A PDF will get downloaded to your browser, and you can click on it and then print from there. Okay. Kamal, do you have any other questions?
Let's pause and see if there's any questions about this report in the chat box.
There is a question in the chat box, but it is for a different report, so perhaps we'll wait.
Okay.
Is it one
Thanks,
of Yeah. Perfect. Okay. So I'm just going to close this one. Okay. So before we start, Kamal, I just want to, because now we're going to explain the dashboards. I guess before we start, all the reports that Kamal and I have demonstrated to date, even on the previous webinar, has only shown one measure on the report. The dashboards that I'm going to be showing right now, the HealthLink, LIN, and Prevent, the main difference with the dashboards is that they show multiple measures on them, as opposed to just a single measure. So just to begin, I'm going to start off with the first dashboard being the HealthLink one. So I'm going to open up my drop-down, and I'm going to select the HealthLink dashboard. Just before we begin, you may want to use this report if your objective was to see all measures for your HealthLink or a specific HealthLink all at once. You may also use this report to help you get a clear picture of HealthLink's overall performance for all measures as well that they've entered for. So I'm going to click on View. It's going to generate. Like I said before, the required parameters are marked with an asterisk. I'm going to begin. So if you wanted to view your HealthLink, you would select your LIN. I'm going to just begin. I'm going to select the first ones being the central LIN. All HealthLinks within this LIN that have entered data would appear. So I'm going to select the Northbrook Central HealthLink. In this type of dashboard, you can either show the frequency as quarterly or monthly. Quarterly will show the data as entered, say for a quarter, say for January, March, or April to June. If I select monthly, it will just generate all the months. So I'm going to select quarterly. The display option defaults to graph and data table. You have two other options. You can either choose graph only or data table only. Let's leave it at the default. And then I don't want to adjust the start dates. You could want to adjust that depending on if you only wanted to see the latest data period. So I'm going to click View Report. zoom out a little. So CCP is the first topic that always appears. It doesn't matter which dashboard you're generating. The next pages will be the primary care provider topic. So I can see on this graph, it plots both the target and actual for the coordinated care plans. The direction of improvement indicates the preferred direction where I want the number of coordinated care plans to go, which is increasing. I can look at the data table. I can see the target and actual and the amounts that was, say, for October, December. The target was 30 and their actual was 20. And I can see the totals in the total there for me. If I use the pagination bar, I will now see the primary care provider topics. The first one is the target formula and the fields provided with that. The second page plots the actual formula and the fields where they've entered their data. Like before, you can export the file and print it, depending on if you want to do more analysis. Kamal, do you have any other questions?
So since the HealthLink dashboard shows data for multiple measures of a specific HealthLink, I'm assuming that the LIN dashboard would show the aggregate data for multiple measures in a particular LIN. Is that right?
Yes, that's correct. Before we go to that, I just want to remind everyone a quick tip that I forgot. If I wanted to maybe generate another report, say I wanted to regenerate this and select the Simcoe one, a good way is to clear all the parameters, and the way to do this is to hold down Control and press F5. And this is just to make sure you're capturing the most recent data, because there could have been some people, some users that have entered data, and there's a chance by not refreshing, that data may not be captured in it. So it's a good way to do Control F5, reset all your parameters, and then complete that selection. Okay, so I'm going to close this. I'm going to select the LIN dashboard. Just to reiterate what Kamal said, you may want to you may choose the LIN dashboard if your objective was to see aggregate data for all the health links, either within your LIN or someone else's LIN. So I'm going to click View. I'll zoom in. So like before, the flow of entering parameters are the same. With this one, your first parameter is your start year. So you could select which start years you want. I want to select all. All the health links within these start years would appear in these LINs. Okay. It defaults also the graph and data table, and then the start and end date. Okay. So I'm going to zoom out. Since I selected the central LIN, all health links within these start years that have entered data would get captured. So I can see at the top, North York Central Health Link, the South Simcoe, and North York Region Health Link, and the South York Region 1 are all feeding data into this LIN dashboard report. I can see the aggregate data, the target and actual. Flip through the pages, I'll then see the primary care and both the target and actual on the next two pages. Just to maybe give some more analysis, this is also a good report. You may want to start if you want to see the aggregate data total. I generate this. I can see, October to December 2014, 125 was my target, 120 actual. But in the next quarter, my target was 135, but my actual went down. I can do further investigation by generating the HealthLink report or the HealthLink dashboard for each of these to maybe help with that analysis, because this kind of gave me a snapshot. So this is a good report to just give you a sense quickly. So if I go to the next page with the pagination arrow, like before, the target formulas for the primary care is shown with the totals on the bottom and the series representing that. And the next page shows the actual amounts for this topic as well on the series. with the tables on the bottom. And like the other ones, you can export the data any way you want, any of these files, and also print. Kamal, do you have any questions regarding the LIN dashboard?
No, would you also show us the provincial dashboard? What type of information will we see on the provincial dashboard?
Sure. So I'm just going to close this. I'm going to select the provincial dashboard, then click View. Kamal, you may choose the provincial dashboard if your objective was to see province-wide aggregate totals. You may also want to use it if you wanted to compare province-wide aggregate levels for early adopters or the later health links. And you can do this by just depending on the start years that you select. So if I wanted to select only early adopters, I'd select the early start years, generate the provincial dashboard report, and then customize that by just deselecting this and then select the later adopters to see if there is any difference. So I'm just going to select all. We'll keep the display option as graph and data table, and the start and end date automatically defaults to captures the entire data that's been entered for all these start years. And then I'm going to click View Report. Basically what I'm seeing here is the total number of coordinated care plans that have been created province-wide because I selected all start years and I chose the default start and end date. I didn't customize it. I could change this to get a different snapshot. So if I customize it and I change it to the quarter that we just entered data for last time, which was the January-March, it would give me the provincial-wide aggregate totals for that snapshot. So I can see for our total targets, 8,667 is the aggregate total number of coordinated care plans created, and the actuals created has been 7,407. If I go to the next page, it shows me the total target formulas at the aggregate province level being 18,130, and if I want, I can see the separation between each of the fields. And on the last page shows the actual formula. And then the total actual number of PCPs, patients attached, 19,640. Like before, you can print and export the data, any of these, for further analysis if the user will like. Kamal, do you have any other questions regarding this report?
Let's pause and see if there's any questions about these dashboards in the chat box.
Hi, Kamal. There are a couple of questions that I think would be well answered right now. One of them is asking, which report would you use to just view specific health links, to compare those health links? For example, we want to look at just urban health links. What report would you use?
I think it depends. If you're going to compare, say, health links within a LIN, the LIN report would do that. So if you wanted to compare health links, say, within the Waterloo LIN, you would click on the LIN report and you would select the Waterloo LIN and you can compare all the health links within that. You can further expand on that by selecting multiple LINs, and multiple health links within each of those LINs would plot on the graph, and then you can compare multiple LINs like that. If you just wanted to generate multiple individual health links, you can use the health link report and just open it up several times, and then, I just wanted to generate a specific health link and just see it by itself. You could export that data and then generate another health link report with that health link that you wanted and export that data, and you can do it that way as well.
The advantage of using the HealthLink report is that you would have access to the annotations that the HealthLink has provided that would help to answer some of the questions about why there is a distinct improvement or not. The LIN report, where you are able to select the specific health links from across the province, allows you to have all of the health links compared on the same graph.
Just also expand on what I was talking about. in the LIN report, it does have a custom group feature. So when you pull down the drop-down box in the LIN report, you can select the custom group and then the LINs that you would want, and it doesn't pre-select the health links. And then you can choose the health links within those LINs that you do want, and then generate your report, because that's what the custom group has been added there for.
Thank you. Those are great responses for that question. Another one. Are there reports that do not have graphs? I think I'm rephrasing the question, but I think the point is looking at, are there specific reports that do not have graphs?
Yes, there are. So the provincial snapshots that we just showed doesn't have a graph, and the data entry status, which I will be demonstrating, doesn't have a graph. And then each of the dashboards, you can choose not to display the graph by changing your display option to the data table only. And I can do that. I'll just show you right now. If I did choose the data table only and then click View Report, it would just show the data table then. And then you have any of the dashboards without the graph.
That's great. Okay. One more question while we're pausing. Will HealthLinks be using the same assumptions to generate targets? For example, are targets going to be set using population data? Are they going to be setting targets by having 5% of a specific cohort?
Thanks, Julie. There have been no decisions made, as far as I'm aware, it's Sandy speaking, around target setting at this point. Should there be any further decisions made about that, we'd be sure to share that.
I think that the questions that can be answered right now. Let's continue with our presentation.
Thanks, Julie. So I think, James, there's one last report that we were going to look at called the Data Entry Status Report. Could you show this one?
Yeah, of course, Kamal. So I'm just going to close the provincial dashboard and select the data entry status and click on View. You can select one or multiple LINs. So this time, let's select the Erie St. Clair LIN. What will happen right now is it'll display all the health links that have entered data in the Erie St. Clair LIN in the data entry status report. You can add more if you'd like, or select all. You can customize the start date depending on what needs that you would want. So just to give you an insight, you may want to use this report to quickly visualize when data was entered by your health links for their measures or for one or multiple LINs. You may also want to use this to determine the proportion of health links that have entered data for all the measures. The reason why you might want to do that is because, say you generate the health link dashboard, it doesn't have the proportions on that report. So you could also generate this report as well, and then you can, if it's in the same time period, and you can see the proportion of how many health links have fed into that data. So I'm going to click on the View Report. It's just a minute. The internet is a little slow right now on our end. There we go. So the health links will appear in alphabetical order. I can see the start year associated with it. The measure always goes in alphabetical order. I'll show CCP first and then the primary care. And basically what I'm seeing here is, for the CCP measure, I can see with this health link within this LIN has first entered data for the CCP topic in December 2013. I can see they also entered data for June 2014 and September. If I use the scroll bar on the bottom, I can see all their data entries that they've done for CCP. I can also determine this also for the primary care when they're entering data. And then I can see also for the Essex County, if it went on to more than one page, I used the pagination arrow to do this. And just to reiterate what I said before, so basically what I'm seeing here, when they're entering data is, you know, if I did have a provincial dashboard and this data entry stats captured that, you know, I can understand how many of HealthLinks have entered data to help support what I'm seeing in the provincial dashboard. It gives me that proportion with this. So sometimes you can generate two reports, you know, they both give you different answers. Do you have any other questions regarding this, Kamal?
No. Before we go back to the slide deck, let's just check with Julie. Are there any more outstanding questions?
There are actually a question slash suggestion. One is, have you considered showing cumulative volume to demonstrate increasing or decreasing distance between the target and the actual? So I think, is that something that's been considered?
Oh, sorry. It's Kim Kinder. Hi, I'm also a quality improvement team lead with HealthLinks. So why is there a difference between actual and target on primary care affiliation? Why are they on separate sheets?
No, it was a different question.
Oh, sorry.
Could you say that question again? Sorry, Jennifer.
Sure. Yeah. No, it was, have you considered showing the cumulative volume to demonstrate the increasing or the decreasing distance between the target and the actual? I think that's just a question slash suggestion.
Terrific. And what we'll do is, so we're taking all the feedback that we get for any of these reports back, and we have a committee where we're going through and sort of looking at ideas like this. At this point, we haven't put that onto the plan, but certainly appreciate the comment and take that back to the committee. So thank you.
And Kim, while we have you here, that the question that you started to read out, why is the actual and the target PCP on separate pages?
That's on separate pages because there's multiple fields that actually are added together to create a final number. So for primary care, there's actually 3 different ways that people are actually reporting with it. So you could have 3 different targets that are all added together to create one final number. Because it's a formula, it automatically goes on 2 different pages. Having said that, again, we've heard back from the last webinar as well that it would be helpful to have those on the same page. So we're taking that information back as well. Thank you.
Great, thanks, Kim. Another question, not necessarily about the report, but it's wondering how HealthLinks are capturing primary care attachments. Is it through Healthcare Connect or other means?
My understanding is that it's through a variety of means. I think most are using Healthcare Connect, but not all.
Okay, thanks, Sandy. Just taking a last look here. I think those are the questions for now. Thank you.
Thanks, Julie.
Thanks, Julie. So as we're going back to the slide deck, we'll just remind you that you can log out from QI-RAP by just closing the window at the top of the page and then hitting log out. Perfect. So just to go back to the slide deck, this is just a summary slide that shows you the difference between all the reports and the dashboards on QI-RAP. You can use this slide as a quick reference if needed when you're deciding which one that you want to generate. And just to review, the main difference between a report and a dashboard is just the number of measures that will be displayed in one document. So a report will display only one measure at a time, whether you're looking at it at the HealthLink level, LHIN level, or provincial level. And a dashboard can display multiple measures in one document, and you can look at it either at the HealthLink level, LHIN level, or provincial level. So I'm just going to hand it over to Sue to continue with the slide deck.
Hi, thanks, Kamal and James for that demonstration of those reports. So I'd like to move now to the data and what to look for when analyzing your own data, both historical and current. Ensure the numbers you entered are correct on the reports and that you annotate your story so others can understand the information. So for example, a health link changed the process step in how to link up patients with primary care providers. Ensure that you annotate that data point to reflect the change. Or another example could be that if your health link experienced an interruption in workflow, which resulted in a decrease in coordinated care plans completed and reported, you would also want to annotate that data point as well. Using run chart rules to analyze the reports will assist you in determining whether you need to annotate shifts or astronomical points. Information on run chart rules can be found on our website or by contacting your QI specialist. Once you run the reports, after you enter your data, you may notice lump amounts, zero or whole, so be sure to annotate these as it will help others understand the reports. If you see the exact same number of coordinated care plans reported consistently over several quarters, this could mean cumulative total for that indicator were entered each time. However, there have not been any additional coordinated care plans completed, so this could be a flag for you to review your data. Ensure there's no duplicate information that was entered, and if you did enter zero, it is a representation that no coordinated care plans were generated, as opposed to the zero being a placeholder. And viewing the reports to ensure your data is correct and will make sense to someone else. So making sure that increases or decreases on the graph or in the tables are logical and that there are annotations to explain the changes in data. Next slide, please. To understand what is happening around the province, you may want to look at data for other health links or LINs. For example, you decide to look at a specific geography and choose to view the northern portion of the province. And so in my example, you chose Northwest, Northeast, and North Simcoe Muskoka LINs to view their numbers for the indicators, as they might represent a different mix of rural and urban health links. And I think that goes back to one of the questions earlier. So yes, that is possible. Some of your analysis could include looking at those increases over time. Is the data stable? And does the report explain any variances with the use of annotations? So a sharp increase in reported coordinated care plans that has been sustained over 3 quarters might be worth further investigation with that LIN or actually that individual health link. Next slide, please. So what stories does the data tell us? So usually we like to ask ourselves, where are there increases in the indicators? What health links have seen some sustainability? Is there evidence of spread? And are there areas of focus for improvement? The next slide. So we ran a report for one of the health links to demonstrate what the data looks like for coordinated care plans. And from this slide, we can see that this is an early adopter of health link. They started off quite slow and steady. And then we see a rise between June 2014 and September 2014 in the number of coordinated care plans reported. That increase was sustained for the past year, and then the numbers decreased. And as a learner, I might contact the Southeast LIN, which is the LIN that's on the screen, to inquire what process changed, how might I learn from what they changed that created the sustainability over that 1-year period, and then again, why was there a drop in the numbers in June 2015? Next slide, please. So data can help us identify areas of focus for our work by using a framework for identification, evaluation, and implementation of emerging innovations. The data that identifies an emerging practice will help to encourage health links to connect with each other, share their learnings, and enable a spread across the province. Next slide. This slide highlights the data collection period on the left. So which quarter, on the left side, you'll see which quarter the dates relate to in the quarter column. So the first column on the left is the data collection period. The second column, the quarter, which quarter it relates to. The data needs to be entered by, and the month that you will enter that data for that collection period. For example, for Q1, the period between April 1 and June 30th, the number of coordinated care plans completed from April 1 to June 30th would then be entered as the total into the month of June, which is the last month for the first quarter. And you enter it in as of June for the first quarter. And this information currently needs to be entered by July 31st. And as you can see, we've put the dates up for the other 3 quarters for the rest of the fiscal year. Next slide, please. As you continue the learning process, you may be looking for some support. So support includes the user guide, the recording of these webinars, and an email helpline to assist you. And all are found on the HQO website. And most importantly, you do have access to a QI specialist who is knowledgeable in both data entry and viewing reports. So please feel free to contact them with any questions. Next slide, please. The first webinar in April in our series of webinars on QI Wrap is recorded, and you can view by copying and pasting the link into your browser. We have included the links to both English and French versions of the slides and user guides. All information, including webinar slides and user guides, are all found under the Health Link tab on the HQO webpage. Next slide. Just a quick review on the user guide. It's available to anyone who has been set up with login access with a username and password. And the user guide includes the step-by-step directions from login, entering your data, viewing reports, depending on your access profile. We have added screenshots to help you walk through the guide, which coincides with the QI Wrap program. If you experience any technical difficulties, we have provided an email address that you can report problems to, and someone from HQO will respond within 1 business day. Next slide, please. So in summary, using the data to support Health Links allows you to look at data locally and provincially and view your own reports immediately after the data is entered. Data can encourage learning and sharing of information across the Health Links, which will accelerate adoption and spread of innovative ideas. And again, the QI specialists living in your region are available to work with Health Links in support of spread of best practices and measurement. Next slide. This slide is just a reminder to a series of webinars in the coming months. And I believe communication has been sent today or will be sent very soon, outlining all the dates. And each webinar will take place from 12 to 1 p.m. on the dates on the screen. And if you need any further information, please contact HQO or your QI specialist within your area. Next slide, please. So lastly, here's a list of QI specialists across the province for each of the LHINs. And before we close out, I would just like to ask Julie if there's any other questions in the chat box. Thanks, Sue. There is a question. It's a question again about similarities across the province, and the question is, how do we know that we are all completing care plans the same way so that our data is comparable? For example, are all Health Links going into patient homes to complete the coordinated care plan?
Hi, Kelly. It's Sandy. That's a great question, and I think that's been one of the burning issues across the province since we started collecting this information. To be quite honest, the definitions were fairly loose over the past quarters, and it's been when we started entering the data into QI Wrap and being really transparent with one another about our data that people have gotten very interested in making sure that we're comparing apples with apples. Right now, the definition for the coordinated care plan is listed within QI Wrap. So if you look there, you will see that the definition of a coordinated care plan says that there is at least one issue that is being addressed, and that the plan of care has been developed by 2 or more people in collaboration with the patient and or their family. That's the minimum requirements at this point. Regarding all other aspects of the for example, has it been circulated to the whole team? Is there a fulsome plan of care? Several other aspects that one might consider part of a completed coordinated care plan are not yet required as the minimum requirements for a coordinated care plan. I think as we go forward, I know as we go forward, that will become much clearer and much more directive and much more standardized across the province with respect to that definition, and we're just going through that process right now. But thank you very much for raising it, and we'll certainly work with all of you in ensuring that as we go forward, we're all comparing the same things.
Thank you, Sandy. Julie, is there any other questions?
There are no further questions at this point.
Okay, thanks. So just to wrap up, we will send out all the question and answers back to the group as a reference for you. And lastly, you will receive an email with a short evaluation of this webinar. Please take a couple of minutes to complete it as it helps us improve our product. No further questions, so we will wrap up. And thank you so much for participating, and we look forward to supporting the learning across the province. So have a great day, and thanks for participating. Thank you very much.